Hi, I'm Dr. Matt Alexander, and I'm going to talk to you today about chronic pain and carb intake, insulin release, and inflammation. Now, before we get started, if this topic interests you and you have more interest in learning about nutrition, go ahead and hit the like and subscribe button down below and ding the bell, and you'll get more information like this in your feed. So let's go ahead and dive into it. Today we're talking about chronic pain. So I, as a chiropractor, have a full practice where I'm seeing patients on a daily basis. And although they do respond really well to chiropractic adjustments, there are some patients, quite a few actually, that feel better, but then the pain continues to come back. And a lot of times these patients have pain in more than one area of their body, in multiple areas of their body. And a lot of times they're left wondering, why do I have all this pain? And oftentimes I'll ask them, well, how's your diet? And they'll say, well, my diet is pretty good. I eat fruits and vegetables and whole grains and a few treats here and there, but mostly pretty good. And I'll start talking to them a little bit more and I'll say, well, how much grains are you eating? And when I really kind of dive into it deeper with them, it turns out they're actually eating quite a bit, which is consistent with what the government recommendations are. But in reality, what we know is that high excess amounts of grains, whether they're refined or whole grains, do cause a spike in insulin release, because that's carbohydrate. Now, fruits and vegetables have carbohydrates as well, but they don't spike you quite as much as the grains do. And so our body is fine having small amounts of insulin in our body. That's normal. It's part of our normal process. But when you see big spikes of it, it actually causes inflammation to our body. And it causes a whole host of problems, one of which is chronic pain. And so increased carb uptake equals increased insulin release from your pancreas. And that increased insulin release causes increased inflammation. And that can be in the joints of your body, it can be in the muscles, but also we're now finding that a lot of chronic diseases are actually caused by inflammation as well. Alzheimer's, dementia, heart disease, diabetes, even a lot of cancers, we're finding strong links to inflammation. So, moral of the story is we need to keep our carb levels at an appropriate level so that our insulin doesn't have big spikes and lulls. And if you're noticing that your energy levels throughout the day are going up and down throughout the day, or you're having that crash in the afternoon, there's a high likelihood that you're not eating the correct amount of carbs. So that's kind of what I specialize in, is coaching people through learning how to eat properly, not only so they can look better and feel better, but also so that they could avoid chronic disease and chronic pain. So this is a little message for you guys today. I have a lot more information about this on my website. I'm going to put a link down below to my website. If you're interested in learning more, go ahead and click that link and you can follow along over there. Also, if you like what you listened to today and you want more information like this, don't forget to hit the like and subscribe button and ring the bell down below. This is Dr. Matt signing out.